METABO is a research project partially funded by the European Commission as part of the 7th European Framework Programme for Research and Technological Development applied to health. METABO is focused on improving diabetes management by providing physicians and patients with an integral technological platform to aid them in handling and analyzing all of the information related to treating diabetes. Diabetes is a chronic incurable metabolic disorder which presents when the pancreas ceases producing insulin or produces too little insulin for the body to function properly. Insulin is a key hormone for the human body to be able to use glucose as a source of energy necessary for carrying out any bodily activity. According to the International Diabetes Federation, 285 million people worldwide are currently diabetic. 5 to 10% are type 1 diabetics. This is the most widely spread chronic disease among the developed countries. If diabetes is not properly treated, it can shorten a diabetic's life expectancy by 15 years. Similarly, diabetes is usually the cause of many chronic complications such as diabetic foot or cardiovascular problems. The treatment provided to patients in different countries, cities or hospitals currently varies greatly, it therefore being necessary for common treatment guidelines to be set out to be followed by all. It is within this environment that the METABO project came into being. METABO is backed by 21 partners from 9 European countries. Regarding the academic aspect, special mention may be made of participants including the University of Kuopio in Finland, the University of Patras in Greece, the University of Augsburg in Germany, and the Polytechnical Universities of Madrid and Valencia in Spain, and the National Technical University of Athens in Greece. Collaborating with regard to the medical aspect are the Hospital Clínico in Madrid, the Charles University in Prague, the University Hospital in Parma, Italy, the Italian Regional Health Agency of Modena, and the ORT, an education and training organization in touch with France's leading patient organizations. METABO also has the support of the finest companies in the technological sector, such as Ferrari. In health technology, Medtronic Ibérica, a leading company in this sector, is the project coordinator.
The METABO project is a highly important project for several reasons, because it is a project devoted to enhancing the management of one of the most highly prevalent disorders in Europe, where there are several million diabetics. The treatment of this disorder is additionally one of the most widely varying in Europe, more widely varying from one country to another, from one healthcare system to another, and even within one same region. And it is precisely this high degree of variability which is opening up prospects for the industry for significantly enhancing the management of these patients' disorders and facilitating their access to improved treatments.
This project's goal lies in seeking new ways of further improving the clinical management of diabetes by using cutting-edge technology and thus finding new pathways within the health systems which will aid patients towards bringing their diabetes under better control. METABO is a smart system which gathers information from the patients and interprets this data to facilitate treatment and improve physician-patient communications.
In day-to-day clinical practice, one of the main problems is the fact that most patients are not capable of pinpointing why they have experienced a specific episode of hypoglycemia or hypoglycemia, and are therefore unable to prevent these episodes from occurring again. Because the factors which come into play are many: diet, physical exercise, the treatments they're currently taking. This is precisely what METABO is, an attempt to collect all this data. METABO is an electronic diary for patients to be able to keep a record of everything they eat, the treatment they are taking. The METABO platform enables patients to become fully, actively involved in controlling their disorder, since they have to enter the data every day on all of the parameters which have a bearing on modifying their blood sugar readings, such that they take on a leading role in controlling their disorder. METABO also sets up a direct communications channel with the professional team of physicians and nurses who are managing these patients, allowing them to keep track daily of their patients' diabetes treatment parameters.
METABO consists of 2 points at which the users can interact with the platform, one for patients and the other for the physicians, called the control panel. Both are interconnected with the central METABO system, the system which stores and processes all of the data entered by the patients.
Voy a entrar por si acaso para verte.
This large amount of information will make it possible to individualize the diabetes treatment.
De los pacientes incluidos en la plataforma METABO,
We regularly receive the data from the patients included in the METABO platform. This is going to enable us to keep a running check on their clinical record, diet, and physical exercise. Also, if the patients experience hypoglycemia, METABO allows us to make changes in their treatment faster than if we had to wait for these patients to come in for an office visit.
The system will make it possible to readily acquire a tremendous amount of data from different patient profiles.
METABO es una excelente herramienta.
METABO is an excellent tool in controlling interaction among the various elements that play a part in controlling glucose, insulin injections, food, and the exercise that you do. In addition, it allows for controlled and accurate dosing of medicine prescribed for other conditions, not just diabetes.
All this information will make it possible to accurately classify the users into different patterns, thus providing a treatment more closely in keeping with each individual's needs.
One of the most pioneering areas within METABO research is the development of early detection systems for the early, non-invasive identification of the occurrence of these episodes of hypoglycemia.
Each patient is an individual case differing from all others, responding differently to diabetes. METABO is therefore not aimed at a physiopathological classification of diabetes, but rather has defined a view of diabetes targeting each situation or problem confronting most patients daily. The changes in their environment and routine, their physical activity and the hypo or hyperglycemia-related risk situations, controlling metabolic instability or the lack of motivation are the very foundations on which METABO is working to change the situation of diabetes in the world.